So let's go ahead and get started. So the treasurer's report, the balance is 2,275. Is that after Dr. Daniela was paid, or do we still owe her?
No, I processed that payment, and that is minus her fee. So that is the accurate balance.
Okay, so we ended up, we are ending up with a fair amount of money. We don't have to spend it all. No. Okay. Okay, and then recruitment and retention of mental health board members. We have 4 vacancies. I did go ahead and send out, because I was asked, a description of what the board requirements were. Do you have that, Tori, that you could show people? It was
I,
probably just in an email to
I,
one of
c-
the board members.
I can dig it up for you.
Okay. So anyway, we've got the 4 vacancies, and we had interest from one person in the North County. Well, actually, they have several people that seem to be interested. So I'm not sure if one of them was planning on attending, and I don't see Rachel just joined, and she's interested. Pretty sure that it's Rachel.
You want me to move her over?
Yeah, so that she
Okay.
can introduce herself and be.
And I do have the bylaws up whenever you're ready, if you'd like me to share them.
Okay, was it the bylaws that, or do you have the little blurb that I sent out to the supervisors?
Let me keep looking.
Okay, I might be able to find that, but I might lose everybody too if I do. It was probably in an email. I sent an email to each of the supervisors. So, and I copied you on the
Yes,
ones that I remember to copy you on.
I do have the email from Supervisor Rabbit, or to Supervisor Rabbit. I don't know if you want to see that one, which
No,
also has the requirements in attached.
the attachment.
Yeah, that's
That's
the,
what I
yes, I
to
do
do.
have that one ready to share whenever you're ready.
Okay, so go ahead and share that
Okay,
so that people can see what I wrote and sent out.
that's the one you're looking for?
Yes.
Okay,
So what I did was I took an excerpt from the bylaws that basically says what our Sonoma County requirements are, and they are taken straight from the WIC code, and I reference that at the bottom. So I think that that will prevent issues like we had with Becky having to step down because she was involved with a nonprofit that was getting funded. And then at the bottom, I put what, not any detail, but just what the current board membership was to show where we needed people. So we're supposed to have 8 people that are either consumers or family members. And we've historically had a need for consumers, but at this point, we have 3, and I'm the only family member identified. So that um, that went to each of the supervisors that has a vacancy. Yeah, so that's what I sent out. And then Carol had, does anybody have any questions about this that you're looking at? Okay, I'm not hearing any questions. So, yeah, so this is something, this isn't what I was referring to, but we can go ahead with it. What I was talking about is Carol had written a recruitment letter that we were looking at sending out to agencies. So that's and we have Rachel is here. Rachel, would you like to introduce yourself while we're waiting for Tori to find that?
Hi there.
Hi.
My name is Rachel Forbes, and I live in Windsor. And let me take off my. Can you hear me?
Yes.
Okay. Oh, my headphones. Okay. So my name is Rachel, and I'm interested in the mental health board, and I'm affiliated with NAMI. I've been attending a lot of group therapy classes and let's see, just family to family, and just attending a lot of webinars through NAMI. So my interest is definitely in mental health, and I'm aspiring to be an art therapist.
And there's 3 categories that that mental health board members can be. One is general public, and one is people with lived experience, and one is family members. So can you just identify which one you identify with?
Yes, so definitely family members.
Oh, okay.
Yes. My parents suffer from PTSD, and we were in the Tubbs fire, so we have experience with that in Sonoma County.
Okay, so thank you.
Welcome.
Yeah, and welcome to our meeting.
Thank you for having me. And I have I'm feeding my infant right now, so I was actually going to have my video off, if that's okay.
That's absolutely fine.
Okay, yeah. Okay. Because I wanted to be present, but my childcare didn't really work out this morning like I had planned. So thank you. Thanks for having me.
Okay. So this needs a little bit revision, but basically, because it says it's recruiting 3 new members and there's actually 4 vacancies, so there's going to be some changes to it, but I would like to for everybody to have a chance to look at it and make comments on it and approve the general concept so that it can be sent out whenever there's a vacancy with minor changes. So if you can just kind of take a look at it as Tori scrolls through, and it's 3's in there too. Yeah.
I can update, excuse me, this part again and email it to everyone after the meeting if you'd like.
Yes, and I think that it might be a good addition to just put in, like, after each person's name, if they are a general public, a consumer, or a family member, because that's information that people would need to look at.
Sure, I'll do that.
Okay. So, any questions about that? Any comments? Okay. So, if there, I don't know if we need to take a vote on this or just if there are no objections, consider it approved. So am I hearing any objections? Okay, so I'm going to
a question, Kathy.
Yes, question.
Are you speaking of objections to the document as far as making it available to potential candidates? Is that the question?
It's this would be sent out to like agencies or people who might know people that would be interested in an area.
I think it's a good idea. And this was originally, you created this to be sent to the supervisors, is that right?
This was originally created, Carol created it, And when we were originally looking for consumers, she wrote one that, was sent to West County Community Services. So at this point, since we're looking for more for consumers and for family members, it would probably go to NAMI and West County and, other possible agencies that might know of people or, have access to people that might be interested, and the supervisors as well, I would think.
I think it's a good thing to have available to send out under all those circumstances.
Okay, so any other comments or? Okay, so hearing no other objections or questions, I'm going to consider that a go. So I'll be sending that to the supervisors in NAMI and West County because they have the peer centers. And for now, I think that's probably, if I think of something else, somebody else I might, but yes, Bob.
Just a question, has Rachel received a copy of this? It might be relevant if she has not.
I don't know if she has or
No,
not.
no, I have not.
Okay, so I can send that to you as well.
That would be great. Thank you.
Okay, perfect. Okay, and I'm just going to briefly mention on Betsy, if you don't mind. I'm going to mention that Becky had to step down because she is her organization receives funding from County Mental Health, and Betsy is on two other involved with two other agencies, on boards of the two other agencies, CDC, Community Development Commission, and CAP, which I can't remember what that is.
Community Action Partnership.
Right. And so Community Action Partnership actually has a small, some funding from the county, but I asked Bill to check it out, and it is through the alcohol and drug portion of behavioral health, and Bill checked with legal, and since we are a mental health board meeting, Betsy's okay for now, so good. Okay, so
And
any other questions about? Yes.
yeah, I do. Just like I mentioned to you over our phone call, if there's any amendment or anything that we could do to change that, just to secure, someone like myself to remain on the board, like, if there's a possibility to have myself, I forget the word, like excuse, from a particular decision.
Yeah.
Once we're voting on, let's say if Hannah Institute were to apply for something like this for a mental health board, monies and, I don't know. So I'm not really sure. I don't remember exactly how I phrased it, but if there's anything that we could do, I think that would be helpful.
Yeah. I think this is my opinion, and Bill can chime in, but since it's in the Welfare and Institution Code, I think it would have to be at that level that a change were made. So I don't know. I think that Bill would again have to check with legal, I think, but I think that it would, since it's at that level, that might be where the change would need to be. I'm not sure that we can do it at this level. So Bill, does that sound right?
Yes, that sounds right to me.
Okay, so, I'm gonna say, like I told you when we had our conversation, I'm gonna say, I hope that you can get some of your, organizations funded through the county. But if that happens, I'm pretty sure that you'll have to step aside as well. Okay, so, that being said, I'm going to move ahead to the number 3, approval of minutes of the March 16th mental health board meeting will happen at our April meeting. And that is, Tori asked me to be sure that everybody had received the minutes, the draft minutes. Has anybody not received the draft minutes? Okay, that sounds like everybody's got them, Tori. Okay, so special topic presentation. What are we going to have presented at our meetings this next little bit? April is North County, so that would be Bob Cobb. Have you had a chance to ask people to participate?
No, I was going to be doing that this week. I thought it was a little early
Okay,
prior to that, and I did contact Peter after the last mental health board meeting and notified him, and he indicated he would be making contact with some of the far north agencies and groups, and I'll be letting the supervisor's office know, as well as a couple of the local area, Alliance Medical, a couple others that were suggested.
perfect. And then, so that'll be April. And then May and June. May is usually the MHSA annual, the plan presentation. And Melissa said that she wasn't ready to do that in May this year and requested to do it later. She said she wasn't going to be ready in June either and wanted to do it in July. But my feeling was that July is always the West County presentation. And I felt like that should, since it's become kind of a known plan, I figured that we should leave July as West County, which would put the MHSA plan presentation into August. We usually don't meet in August, but that seems like the place that it would have to go.
I wonder if we shouldn't talk with Melissa about doing the budget presentation outside of a mental health board meeting this year. Maybe it can be its own public meeting so that we're not messing with your schedule and we're not being later than we have to be.
That's fine with us. I mean, I think that we're supposed to host it, but that doesn't mean that we have to host it during a regular meeting. So if she,
would you call an ad hoc mental health board meeting, or would you like us to do it independent of the mental health board?
I think that the in the MHSA guidelines, it says that the mental health board hosts that meeting. So I think if she did a meeting, then we could just announce it as a special mental health board meeting.
Okay. I'll ask her to follow up with you then.
Okay. Yeah, that would work as well, I think. Okay, so that still leaves May and June. And I'm going to skip down to, well, Bill, are you okay time-wise?
Yeah,
Okay, so Carol had an idea for one of those months, a presentation on the difficulties that mental health clients encounter as they re-enter after being incarcerated. And she had some contacts that she wanted to know if that was inappropriate. She wasn't able to be here, but she has proposed that that's a possible presentation. So I think Tori has a something that Carol wrote up. So this is just a very, it's not a final, it's definitely a draft. But Cal Voices Access are working with the Council on Criminal Justice and Behavioral Health to meet with people who have been incarcerated, who have mental health issues, and talking with them about barriers to getting back into the community. So this is her invitation, but there was a bit of a write-up attached to it as well, right, Tori? Carol is a writer for sure.
Also, Kathy, Mary Frances just did an edit, and Tori and I just got it. So that's really
Is the edit in the red?
no. It's another.
Okay.
Is this the one with Mary Frances' story comments?
This is no, I don't think so. But
Okay.
we'll make
She had some good edits.
the questions for Tori.
I don't see the one from Mary Frances. Is it just this morning?
Yes, I'll send it to you.
Thank you. And then I'll open that one up.
Okay, so while we're waiting for that, we do need to think of what there's 2 months, May and June, that don't have presenters at this point. I personally was thinking that it might be a good idea for the for QIC to present and let us know what happens there and what is happening. They've got I'm sure that they could talk about the externity EQRO, external quality review, and I'm not sure what the O stands for.
organization.
And and they're currently in the process of developing PIPs, which are project performance. I don't remember what that stands for either. Do you, Bill? Performance. Anyway, there's
The performance improvement projects.
Yeah, performance improvement projects. Thank you. So what the QIC is tasked with is looking at quality and where there are issues which are usually pointed out by the EQRO. They come and look at the system and see where they see strengths and weaknesses and places where we could improve. And so QIC looks at these different areas and comes up with projects to help improve in the areas that are weak. So I think that might be a good presentation for one of those months. So I'll come back to that thought because Tori's got the Carol's reentry information up. So Carol's a writer, so she has really gone into some detail here, but the governor, there was a Senate Bill 369 that was going to develop a commission for reentry, and the governor vetoed that, basically saying that it really didn't need a commission, that there were there were other ways to do it. So the governor launched Returning Home Well, a public-private partnership, and he explained why he vetoed it. But Carol is in contact with the group that is providing feedback from people who have experienced incarceration. And so she has reached out to those people that are doing that, gathering stakeholder feedback. And those are the people that she would like to invite to present. So what do you think about that?
I think it's a good idea. I think it'd be very helpful.
Yeah, I agree.
Okay.
I agree. It's Mary Ann.
Okay. So I'm going to, Carol has said that she would reach out to people and to those people, that organization, and see if they would be able to come on either of our dates, May or June. So if they are able to come on one of those, I will say that we have the go-ahead to do that. And then what do you think about the Quality Improvement Committee presenting on the other one? Or do you have other ideas of presentations that need to happen?
For me, a Quality Improvement Committee is a mysterious entity, so it would be informative to hear from them.
Yeah, I know that it is mysterious because it's hard to, I go to the meetings and I know what happens there, and they have made some attempts to identify what part of the meeting I can bring back and what part I can't, but it's not real consistent. So I'm never sure what I'm free to, just put out in a public forum like this. So I think a presentation direct from them might be really good. The EQRO report is available on, I think it's on our website, and I think it's on the county website, and it's also available online. So, that is something that we could look up, and I could actually, but they would present it much more clearly. Wendy Wheelwright and Erica are currently the co-chairs of that group, and they're both great presenters. So I think that either of them would do a great job presenting what is happening there. Yes, Bob.
One of the questions from what you just brought up that I would like to hear about is, what are the categories of topics and areas of consideration which are not available to be public information, and which ones are, so we can kind of distinguish between those instead of just not hearing about certain things.
Yeah, and they've made an attempt to identify that, but often what happens is a topic will come up and it kind of, there's real conversation back and forth, and, people knowing that it's a, somewhat of a confidential setting, people say things that they really wouldn't want to come out. So it doesn't, I personally have a hard time identifying, what can actually come back. And I also, at the beginning of this year, asked about having a second person from the mental health board on QIC, and it was agreed that the co-chair, that would be a responsibility, but Peterson has been not able to do it this year. So we should look at maybe that needs to be just somebody that's appointed that can make that commitment. Bill, I see you're
Yeah, so
ready to go.
I would be interested in talking with the committee too about what it feels it cannot share. I know that one area it can't share is where we're talking about areas that we are addressing where we have liability. So we have some confidentiality granted to us within the QI committee that allows us to work on things that could raise compliance questions, for example. But once we speak about them publicly, we've lost that privilege. So, for example, if we made a mistake in billing and we're fixing it and we're talking about it in this committee, it opens us up to, for example, a complaint. We address all compliance issues through channels we're supposed to, but we still want some protection from public response when we can get it.
Yeah, so I think that there are things like the EQRO report is public anyway, and the performance improvement projects become public, but in building them, there are moments where the group is really looking at weaknesses fairly specifically that maybe don't need to be shared publicly. So this is a really public forum that anybody can look at and refer back to easily. So that's that's probably the reason. And to be honest with you, I prefer having them present what they feel comfortable presenting. So that's what I'm proposing for one of those days, if either of them are available. So does that sound reasonable? Okay, any objections? Oh, Bob? Did you raise your hand? Oh, you put your thumb up. Good. Okay. Okay, and so I want you to be thinking also about other things that you think may be appropriate for the future. And I don't see I don't see an official spot for it, so I'm going to throw it in right here before I forget to do it, and then Bill, you'll be on. But we need to come up with a nominating committee because my term is coming to an end and we need officers for next year. So is anybody willing to be on the nominating committee for that? Oh, I hear lots of people chiming in. Bob Cobb, are you saying yes, you will?
Yes, I will be willing to be on the nominating committee.
Okay. We'll have to find you a partner.
I'm sorry, Kathy, I missed.
Oh, go ahead.
No,
Okay.
sorry, I just missed what you had asked. I apologize.
We need somebody to nominate officers for next year.
And part of this body here,
Yes,
offices for this body. Oh, okay.
and Bob has volunteered to be one of them. And we need
Mm.
at least a couple of people to work with, together. So,
I'll be happy to serve, to work with Bob.
pardon?
I'll be happy to work with Bob.
Okay. And the only thing that you can't do is, nominate yourself. I think that's the only rule. So, if that takes either of you out of the running, if either of you want to be an officer, that, we may need to find somebody else. So,
Of course, other nominations can arise from other than the nominating committee also.
yes, and that has happened in the time I was on the board. So, yes, if you have suggestions for officers, you can give them to Bob Cobb. He's going to be in charge at this point. Okay. Okay, so Bill, did you have a director's report?
Not a lot of new information. Barbie's last day, I believe, is April 16th. So we don't have any more information yet on what the county is doing regarding her replacement. I expect, but it has not been announced, that there will be a nationwide search, and there's no information about what the interim plan is at this point. Internally, what happens in organizations like ours at a time like this is a lot of work that is not required stops pending the, bringing on a new director. So we're doing largely things that have to be done. A lot of our work right now is staffing up. So we've added some positions this year, as announced in previous reports, and we're in the process of recruiting, interviewing for those positions. There's a set of positions in administrative support. So these are evaluation analysts, admin aides, and senior office assistants that are coming on to support the programs. And then there's a large recruitment of behavioral health clinicians for open positions, as well as the expansion of MST. We have a RFP coming out probably in the next couple of weeks for hearing officers. So we contract with people to serve as certification hearing officers for LPS, or Lantrum and Petrie Short Act hearings. So if an individual is in a hospital and the hospital is recommending another 14 days on the hold after the first 72 hours, the difference between a 5150 and a 5250, a hearing officer sits to hear from the treating psychiatrist, as well as the client and patient rights advocate, if the client does not want the hold to continue. So we are going to be doing an RFP for new representatives to serve that function. And then lastly, the budget. I believe the budget workshops start this year on April 26th. I asked Lori to send me the schedule, and I don't see it right now, but my recollection is they start on April 26th. So that'll be when the board makes its first budget proposals available for comment.
Bill, do you have any general impressions in terms of the budget? What's it going to look like?
I will be surprised if we're proposing any cuts, but I don't get to say that yet. We are right now in the process of working on details, right? So where we are short, we propose ways to address that shortfall, and the board needs to hear those proposals and determine whether or not they're okay with that. So for example, Fund balance is where we have savings, and with the little savings account, a little cushion account. And so if we want to propose using any fund balance, we need to get the board's okay before that proposal can go forward. So that's an example of what's happening right now.
Thank you.
So that's my report. I'm happy. Is there anything on your mind? Anything? Oh, the other issue that'll come before the board, I believe it's April 20th, is AB 1976. So this is Laura's Law. Laura's Law is assisted outpatient treatment, which is called involuntary outpatient treatment. So these are services for individuals who do not participate in mental health treatment, but who have frequent arrests and hospitalizations. And up to now, the Laura's Law, which is the initial legislation from, I believe, 2004, allows counties to establish an assisted outpatient treatment program, which is a court-ordered participation in treatment. And you had to opt in, which is to say counties had discretion on whether or not to establish such programs. A recent piece of legislation says you don't get to opt in, you have to opt out. So in order to encourage counties to establish these programs, they are saying the board has to pass a resolution to opt out. Otherwise, you're automatically required to do this. So we've sent a recommendation ahead to the board to opt out of Laura's Law assisted outpatient treatment for now, and continue to monitor the situation and determine if the county wants to take a different direction in the future. The reason for that is manyfold. I mean, so in general, consumer groups are anti-Laura's Law. They don't like more involuntary programs. The fact is we have a lot of voluntary programs that are probably as effective as the Laura's Law program. And Laura's Law comes with no funding and a requirement that you don't cut any services to establish Laura's Law. So you can't reduce services somewhere to provide Laura's Law. So given that collection of facts, right now I'm recommending that we not implement this, that we continue to focus on building our voluntary programs, which are still understaffed and are not, capacity is currently inadequate, so we need to focus there and then reconsider in the future.
Bill, what's the status of the new psychiatric health facility?
The opening date was pushed to August. We're hoping we can move it. It can be moved up. It was pushed to August because one of the inspections requires the fire marshal to review, and the fire marshal was unavailable until August. So we are hoping we can prevail upon the fire marshal to do something earlier. So we're working on that. But for now, the projected opening is August.
Budget's solid for that. There's no problems with the budget.
Should not be. The Measure O, there's the psychiatric health facility is one of the programs that is that had Measure O funding dedicated to it. So that should put us in strong standing to implement that. And then there are other fiscal implications of the PUF that are helpful, right? So right now the CSU is unable to bill for services beyond 24 hours.
Wow.
If there are fewer people in the CSU beyond 24 hours, that means we have the opportunity to receive more revenue in the CSU. And then it's also the case that if we divert anybody from a non-Medi-Cal hospital to the PUF, we save 50% of the cost. So if someone goes to Aurora, for example, which is a non-Medi-Cal hospital, we have to pay 100% of the cost. If they go to the psychiatric health facility, it's Medi-Cal billable, and so we share the cost with the federal government, roughly 50%.
Right.
Okay, any other questions for Bill? Okay, thank you, Bill.
Thank you.
Bill, I have a question for you.
Oh, hi, Peterson.
Hello, I'm here. Will the board be allowed to visit the hospital before it opens?
Yes, the standard protocol would be to have a series of open houses prior to its opening to show everybody the facility at the time it's remodeled, and then to introduce you to the key administrators and managers of that. So I'm sure they will have Crestwood will have an open house before the opening.
Okay. Thank you.
Okay, any other questions? Okay. So the idea of inviting the Board of Supervisors to mental health board meetings twice a year, I think, okay, so in what I sent to them are mental health, the excerpt from the bylaws that I sent to them as far as board requirements. It is part of the WIC code that a member of the governing body, which is ours is the Board of Supervisors, is a member of the mental health board. That's part of the WIC code. And so what I sent to them had that in it. They will all read it. As far as them assigning somebody, I am fairly certain at this point that that's not going to happen anytime soon. However, that are you leaving, Bill? Bye. However, when I asked, I think Chris Kersey's the only one that really responded. And he said that one time a year was, he felt sure that that he would be able to do that. We can ask that again, asking them to come twice a year. I'm not sure what the most effective way to ask them to do it is. I have definitely let them know that their presence is, quote, required. So I'm not sure what the next step on that would be. If anybody has an idea, then, bring that forward. I think it's the idea of moving the meetings to Wednesday has also been met with, well, meetings come up on Wednesdays also. So just a moment. When are you going to be?
Probably like an hour and a half.
Okay.
I'm just gonna go run the Willow Creek Trail.
Okay. Sorry about that. So the idea of them of moving our meetings to Wednesday, I'm not sure from the responses that I've gotten. I haven't asked, specifically, but I'm not sure that that would increase their attendance because they've got meetings all over the place. Although they don't have their big Board of Supervisors meeting all day on a Wednesday. So that is a possibility. I kind of put number 12 on the agenda in with number 6. So I think I want to come back to that. You can kind of, we haven't it's been on our agenda and we haven't really come up with a good solution. But we do need to act on some of the other reports. So the PAM committee,
Yes,
would you like to address that, Bob Hales?
we're proceeding well in terms of our site visits. We have one scheduled for April 15th, the Progress Foundation. Elizabeth Hernandez is one of the presenters, and then Lizzie Pickering, and scheduled for April 15. And then we're working on the second one. And by the way, the board member be Kathy, will be participating. And then the second one, we're just working on a date, and that's the Buckaloo Manor House and their apartment complex, McBride Apartments. And been working with Donald Holmes, and I have Becky Enos participating as a former board member, and then on the committee, and then myself. And then I'm ready to start, I'll talk to Bill, but ready to start scheduling other ones. I just need some assistance, at least one other member. I think Betsy, I think you volunteered in the past, is that correct?
Yes, I have.
And Bob, can I rope you in?
Yeah, depending on what it is, I have interest. If we don't have scheduling conflicts, I would be willing to participate.
Yeah, because we've already, Progress Sonoma will be a crisis treatment, unlocked short-term facility. I've already looked at Parker Hill Place, which again is adult residential treatment. And then the supportive housing programs will be the Buckaloo programs. So in terms of various levels of care, we would have hit multiple levels. So, and then I'm asking the person or group we're interviewing to complete the first two parts of the report, which is a lot of detailed information. I sent them a copy of the questions we're going to ask them. And so that will serve as a framework for completing the report. So it should be pretty efficient. And people have been very supportive and interested in participating. So I think that's speaks well of the potential for getting some.
Bob, I have a question.
Go ahead.
So if so I've had in mind Latino service providers only because they've moved their offices. I think it would be great to see their new space and to hear, any recent happenings. If I were to invite them, would I have access to these questions you're speaking of, or do I include you and then have you send it over, or how do we go about that?
So could you clarify that, Betsy? What I'm just
to invite Latino service providers for a site visit.
Oh yes, you have I sent you the questions. I can send them to you again.
Did you? Oh yes, please, if you don't mind.
Yes.
Okay, perfect.
One area that's ambivalent, haven't addressed is there's a consumer questionnaire. We're just interviewing the project managers. And so any guidance concerning how we would approach then the consumer participation, maintaining confidentiality. So we're able to do that when we visit the site. So like when Parker Hill Place and then the CSU, we could have them sign we would sign a form and say we wouldn't disclose information, and then the consumer would have ability to participate or not participate. But if we do it via Zoom, one of the questions is how would we structure the release of information so the consumer feels protected? That's one of the issues. So I haven't included the consumer on the participation, but any guidance you may have would be appreciated, how to approach that.
Yeah, I have to think about that a bit.
Yeah,
We're starting with the program managers, so they've been very interesting.
yeah. Different programs are, have different requirements as far as visitation, but some of them actually allow, allow you on site. So that would be, one thing to ask them ask them if there was a way to access.
Okay.
And I want to comment on your choices of places to visit. You've got a range of housing there, a range of, places for people to live, but I am somewhat familiar with all of those programs, and they are all have a time limit. They're all 1 year maximum stay. So maybe including something like Brown Street that can be a forever, situation might be another, step.
So is Brown Street a board and care facility or?
It's a board and care.
Okay, we haven't included any board and care, so that would be great.
Yeah, it's
Okay,
it's also Manor House and the apartments, McBride Apartments are CSN, and so is Brown Street. They have quite a few programs, but I think that would kind of fill out your, your housing.
But on the supportive housing programs, Manor House and McBride Apartments, I didn't realize there's a time limit.
They're considered a continuum in the approach to independent housing. They have the medication. They don't have an on-site, they don't have on-site staff, but they have daily medication monitoring.
And how is, Kathy, how is Brown Street different?
You can live there forever
Okay,
if you're good.
okay. Well, information from Bill then, because we could add that to the list, because I was going to ask him for 2 more facilities, because we're moving on.
Yeah, I would include that one.
So they'll be included.
Okay. Yeah, and go ahead.
I was saying last year we were hoping to visit SAY, but we were not able to because of the COVID. So
Right. That could be added too. And I think Bob Hale, you are doing a great job of kind of organizing who is, being visited. And we probably need to clarify, like Peterson had made contact with SAY. Should all of the visits go through you, or should, like Betsy was talking about Latino service providers and Peterson's talking about SAY, should they set those up separately, or do you want everything to go through you? Bob Hales.
I think they could set that up separately, because what's nice about the process, all the questions being asked are the same. And as long as they use the form, then it'd be easy to compare. So I don't think it makes a difference. Just to keep me informed would all be necessary. You're doing a site visit as SAY, or like Betsy's going to do a site visit. I'll send the forms to you, but then when you complete the survey, if you could just send me a copy, and then then the board will go over it. Executive committee is supposed to go over the results, so, but you don't have to go through me.
Okay, I think that was important clarification. So thank you for everything you're doing, Bill, Bob. So, okay, anything else that you need to say about the site visits, Bob?
No, actually, things are proceeding well, and people have been very responsive, the staff of the agencies. So It's great. Well, I'm trying to schedule the second one in last week in April, first week in May. So after that, have May, get 1 or 2 a month. So CSU I've already seen, but that might be one to continue. I'd follow up again. So,
Right. And I was there, yeah, with you on that one too. So I encourage everybody to take a turn at doing a visit. It's very informative.
You'll find
Okay.
very enthusiastic, they're very positive about having the board interview. It's not like viewed as a hardship, or they view it as positive sense, an opportunity for them to convey what they're doing. So I see that as in a win-win situation for everybody.
Yes. Okay. And then did you have anything about the jail mental health that you wanted to say?
I think the one thing is the lack of responsiveness, because we had a meeting with representatives and then Carol wanted to follow up, and also Mary Frances, but they don't really respond that much. Hard to get their attention. So that's just a problem. There's no solution for it. It's not exactly a robust relationship.
Right. You've made good inroads, but it'll probably take some persistence.
Because we wanted, one of the ideas is have them present on a periodic basis to the mental health board of what's going on. I don't know if people have ever heard the details about the jail. We've seen some presentation, but even more details because the jail structure for the new mental health unit has changed quite a bit. And the funding's different, it's delayed. So that's one agenda we try and like to get them to accomplish, but we'll have to see.
Well, maybe if the, yeah, I know Carol is trying to get this, the group, to come and present on, the barriers to returning to society. But if that, we should put that on our list of possible presentations. So
Yes, that's
it looks like if we have 2 for May and June that we're looking into, we're not sure whether either of those are available, but I'll put that on the list. Okay.
I'm gonna jump in.
Yes.
This is Bob Cobb. A couple of things. I just saw that Mary Frances indicated a new director is awaiting appointment. I had a sense also they had more than just that one position that had changed based on some of their recruitment ads that I'd seen. And I'm surprised to hear the absence of ongoing cooperation given the glowing reception and the information that you'd shared when several members went and met with them in person. But I guess things do shift, especially I would think with the personnel changes. But I do have a question going back to, are we speaking of virtual visits still as opposed to in person, or what? I need clarification on that.
Yeah, we're still having virtual visits, not on site.
Okay, great. Thanks.
I also have a follow-up question to that pertaining topic. I'm wondering, how do I know who's on the list? I'm not sure. For example, does Humanidad get funding, and is that a potential site to visit, or how do we know who's on the right list, or what list do I access?
That's a really good question.
What I've been using, there's this multi-page list of all the programs for the adult mental health services and the child services, and all the boxes. And do you remember getting that?
Yeah, I made that I made that list up and I think Tori put it onto Excel. Is that the one you're referring to?
Well, that's one, and I think we all got that. But then there's a multicolored one, which has boxes and kind of shows the relationship to each other. It's
I
more,
don't know that I've seen that one.
and kind of describes the program.
Yeah.
I think someone passed that out.
Well, if it
But-
was, me, I'm not sure that I'm remembering it. So maybe share that one so that we can see it. And then the one that I made that Tori put on the Excel
Yes.
was intended to help us keep track of where we were visiting
Yes,
and when we were doing it.
yes.
So maybe Tori can share that with you again and somebody can be keeping track.
Well, I'll complete that and then what I know. And then if Peterson could add his participation, which programs say or others, so we could keep a running record of who we visited and when we visited.
Yeah, that would be excellent.
That's a good idea, Kathy.
And that list that I made up that Tori has now on Excel, programs can be added in as we realize that they're missing.
Yes.
Yeah.
Right. Thank you for that.
Okay. Okay. So anything else in the committee wise? Okay. So moving on to the agenda item 8, acknowledging Sonoma County behavior staff. Well, Erica's kind of not staff, but she's certainly involved. And we didn't acknowledge her last month because she had a family emergency and wasn't available. So I will do that, but we should add somebody. And I'm thinking, we were talking about going back and forth from a person to an organization. I'm thinking that maybe we should acknowledge Barbie Robinson since she's leaving. And she's been, she's kind of guided us through a real rough couple of years. But
And given all the multitude of responsibilities she has, she definitely is an organization.
she is an organization. So does anybody have anybody else that they would like to acknowledge, or are you okay with her?
I think it's well deserved.
I certainly support Barbie Robinson.
Yeah, I mean, I didn't realize that she was so new when when she jumped into our, I know Marianne, you remember it, and I don't know how many other people were there when we were really going through a quite rough patch. And she really has been there during the time when the transparency of the system has opened up. So I do appreciate that.
She's a very smart, very able manager. And I was sorry to see that she was leaving the county.
Okay, so if that's okay, maybe Marianne, you can help me with some of the wording on how to acknowledge her. But if there's no objection, we'll do her and be thinking about the next one. Okay, so any objections or comments?
Just a suggestion, or just confirming, would that include an invite to attend the mental health board next Zoom meeting where that would be acknowledged?
I think that we would have to do that. Yes.
So to confirm, are we inviting her and acknowledging her for April? Along with Erica or May? Barbie.
Let's do April.
So do Erica and Barbie for April?
Yes.
From what I
Erica-
heard, Barbie will be gone by May, so we better.
Yeah,
That's what I'm thinking. Let's do April.
Yeah, so I
Yeah.
wanted to clarify. I'll make sure and send her the invite when I create the appointment.
Yes, and the 16th, is that our meeting?
I believe it's the 20th, if I recall. Yeah, it's the 20th.
Our meeting's the 20th, so she will not be, I mean, if her last day is the 16th, then she'll probably still be around. An invite is good. She can always Zoom in. I mean, even if she's not physically here. Okay, so thank you for doing that, Tori. Okay, okay, May, I'm going down to 10. Mental Health Awareness Month. May is Mental Health Month. And thank you, Bob Cobb, for getting the requirements for the close to home. Carol has said that she is willing to write a column, but if I think that maybe we should, make a brief list of things that we want maybe addressed in there so that she has a little bit of guidance. So does anybody have a direction that they think should be included in that? Okay.
Could we send an email with possible suggestions and
I
just
think-
include the board here?
Yes, I think that's a good idea. I'm thinking that, Carol's pretty on top of most of the areas, but if we give her some direction on what to focus on, and we have had some dynamic presentations, and I think that if she talks about some of the content of those, and so that we had trauma-informed care and we had the racial inequities, and there's a lot of material there. So I think that she's such an excellent writer that I think that her I'll ask her to pass it by us potentially for the April meeting, if she can get it together that fast so that we can get it in.
yeah, if possible, it would be great to have it final draft somewhere around the April meeting so it can be submitted with enough lead time. So we might
Yeah.
even get in on the first Sunday of May in the Press Democrat.
So I'll ask her if she can get that together. Okay. So I'm writing all over my agenda, so it's getting hard to read here. So that is what we have. That's all that we have really planned for May as Mental Health Month. I know that there are a few other things going on, and I forget who it was, but somebody is going to put out a list of all of the activities that are around. So I am glad that we're going to acknowledge it with the close to home article. I don't know that we have plans or time to plan anything else for May. If anybody has that kind of energy, then volunteer, but okay. So that's
There's a comment, Kathy.
A comment.
from Mary Frances saying that Melissa Ledrich has gathered a list of activities from agencies for May in Mental Health Month.
That is the person that I heard was doing it and had forgotten. So thank you, Mary Frances. So we'll get that list from Melissa. And if she has it, we can put it out at our April meeting. If not, we know that that is happening. Okay, so we had talked about having another retreat to put together a statement. A vision statement or something of that sort that kind of pulls together the trainings that we've had. So I'm thinking that it would probably be a couple of hours on a Saturday in the next 2 months. So Tori, if you could put together a doodle poll that asked people when they would be available on a Saturday morning for, I don't know, we can probably, it would be easier to shorten it if people committed 3 hours. It'd be easier to shorten it than to lengthen it. So
Okay. Do you want me to start maybe looking at like the 17th of April and going forward, or what date? Is that too soon for people in their schedules?
I think the more options you have,
Okay.
the more likely we're going to find a date that people can all come.
Okay, I'll send out a doodle poll shortly with dates in end of April through May and maybe the 1st of June, just to give good options.
Yes, that sounds good. Okay. I am at the end of the agenda. Does anybody have additional comments or anything to add? Okay. I think we are done for today then. So thank you for attending, Rachel. We look forward to seeing your application.
Thank you. Thank you for letting me listen in and learn more about what's going on in the community. And I learned a lot from this meeting, so thank you.
Well, we look forward to your application then.
Okay, thank you. Take care.
Okay, you too.
Bye-bye.
Okay.
So everyone get out and enjoy the sun.
Yes,
Thanks, Catherine.
yes. Okay.
Thanks, everyone.
Good job, Kathy.
Thank you.
Thank you.
You came